Commercial break. Thank you and welcome back to the second segment of our show for today. We're talking to Dr. CPoe, and the topic is negative spirituality, mental illness, and violence. And of course, Dr. Poe, you gave us so much information during the first part of the show that we want to give you an opportunity during the second segment to elaborate upon some of the things that you've talked about, and especially the idea of self-centered behavior and those and how that impacts upon violence and mental illness and et cetera. Let's talk about it from that perspective.
Right. Well, first I want to say that violence is the #1 threat to the security of the American people, violence. And we need to make more of an effort to understand this problem. I don't think we can do it by simply relying on psychological, psychiatric, and sociological analysis. I think we're going to have to bring in spiritual assessments and spiritual analysis as well. For example, the sniper in Washington, D.C., obviously, to me, is a person who has been damaged. His self-esteem has been severely damaged. His image of himself has been severely damaged. And my assessment is that he has a very low or an extremely low self-esteem and has an extremely negative image of himself. Now, that could have derived from being, from having grown up in a hostile, rejecting family environment. It could have derived from being abused by an alcoholic father. It could have derived even from his own self-centered behavior unrelated to having been abused. And it could have derived from both situations. But nevertheless, this man's self-esteem is extremely low. His self-image has been severely damaged. And I believe that when we find that kind of a situation, it pushes the person into reactive behavior. And often the behavior then becomes self-destructive, alcohol abuse, drug abuse, okay? And it becomes destructive of other people. Mental violence, emotional violence, physical violence, sexual violence, and even homicidal violence, okay? Now, so often when people have a damaged self-esteem and a damaged self-image, they become reactively destructive toward themselves and or towards others. In addition, some persons decide to get even because they feel damaged, and they feel that the damage has been done by others, okay? So they decide to get even. And oftentimes—
That's revenge.
Yes, absolutely. They decide to get even. I'm glad you mentioned revenge, because these persons decide to become determined to have their own way. And I call that revenge-focused behavior, okay? And when a person is motivated by a desire to get revenge because he or she has been damaged in the past, you've got a very, very dangerous situation. So I believe that the person who is killing the people in Washington is reacting to a damaged self-image. And I also think that he is acting out of a wish to get even, and he has projected his rage onto everybody. And I just believe that his fantasy is to kill everybody one by one. And of course, at a subconscious level, he's trying to get even with God.
Well, now, how do you, now, I know, Dr. Poe, that he does not represent the only individual who might fall within that category. There might be millions of folks who fall. I mean, what do you do about people like that? Those folks are not only dangerous to society, but they're, as you indicated, self-destructive and etc. They're dangerous to themselves. I mean, how do you deal with that?
Well, first of all, I think we need to do some definitive research that helps us isolate out the factors, the major factors that contributes to a severely damaged self-esteem. We need to examine people who are locked up, people who have been charged with felonies, murder, robbery, rape, and get a true assessment, a biopsychosocial spiritual assessment of that person's self-esteem. We need to become convinced that violence is intimately related to a damaged self-esteem, and a damaged self-esteem very often starts in the home, in which the parents are so busy that they don't have time for the child, and so their input is usually one of hostility and rejection. So we need to look at the American family. We need to do research in the area of self-esteem and to examine how it correlates with violence, so that we can then take some action to improve family life, to help people overcome damaged self-esteem. Because if we don't, they're going to end up becoming violent in one way or the other.
Dr. Poe, are you also saying that this really does not matter the socioeconomic situation from which the family comes?
No.
Explain it.
Well, as a matter of fact, I really think that if we really examine families, upper income, middle income, and lower income, there's probably, I believe, as much rejection on the part of parents who are part of the upper income group as there is in persons who are part of the lower income group.
And so no matter what family, whether we're upper, lower income, these are some of the problems that you find within the family structure that we're not dealing with.
Absolutely. Parental neglect, parental abuse, parental indifference. It causes people, it damages people's self-esteem, and once a person has a damaged self-esteem, you can expect that they're going to go overboard and being destructive in their behavior towards themselves and or towards others.
2 minutes before the ending of this segment, Dr. Poe, are there any indications or any signs of warning that we might be able to detect of individuals who suffer under this kind of spiritual neglect at an early period before they become old enough to really cause real problems?
But I think that a damaged self-esteem very often will manifest in terms of behavior. Usually the behavior is either aggressive, overly aggressive, or overly withdrawn. Oftentimes, we see evidence of it in children who are unable to pay attention in class, or they are hyperactive and impulsive, the so-called ADHD diagnosis, or oppositional defiant disorder diagnosis. So usually the very low self-esteem will manifest in the form of a behavior problem that's either very withdrawn, inappropriate, or inappropriately aggressive.
And so we ought to be on the lookout as public workers, as teachers, and et cetera, for individuals who might fall within that category.
Absolutely. As a matter of fact, our schools have become hospitals, mental hospitals in many ways, because they're the ones who get these kids, as you know, beginning about age 5.
Okay, very good. And of course, Dr. Poe, we're coming to the end of this second segment, which we've got about a half a minute here. And when we come back, we want to give you an opportunity to elaborate upon some of these things and of course, introduce us to some of the things that you have already talked about dealing with depression and anxiety and the psychological impact that has upon individuals and et cetera. And of course, we'll be back with our audience following this very, very short commercial break.